It's time to sit back, relax, and listen to Change Your Attitude, Change Your Life. Change Your Attitude, Change Your Life will inspire, motivate, and empower you. Live your best life now. Listen, learn, think, and decide. Change your attitude, change your life. And now, here's your host, Joan Herman.
Welcome to Change Your Attitude, Change Your Life. You're listening to us in your neighborhood, from coast to coast and around the world. Thanks for tuning in. I'm Joan Herman, author, speaker, and your host. For 4 years, Change Your Attitude, Change Your Life has been bringing you interviews with some of the most inspirational and influential people in the world. It's our goal to educate and empower you so you can live your best life now. Thank you for taking time for yourself, and thank you for letting us be a part of your life. We have another great show for you today. Joining me are Dr. William Sears and Martha Sears, trusted experts on pregnancy and baby care. They're here today to provide up-to-date information and advice for pregnant women and new parents. Dr. Sears has practiced pediatrics for more than 40 years and is an associate clinical professor at the University of California, Irvine School of Medicine. Martha is a registered nurse and parenting and health consultant. They are the authors of more than 30 books. Welcome, Martha and Dr. Sears. Thanks for joining us today.
Thank you, Joan.
Thank you, Joan. Happy to be with you.
You know, Dr. Sears and Martha, it's been a long time since I was pregnant. My baby is now 18, so we've really seen some major changes in how things were done and what we know now about prenatal care. If you had to sum it up, what would you say are some of the most significant things that we've learned about prenatal care? And let's start with you, Dr. Sears.
All right. I think the main thing we've learned, Joan, is how important nutrition is. How important the right supplements are, such as omega-3s and folic acid. We've learned that how a mother feeds and takes care of herself can influence how healthy her baby is and how healthy her pregnancy is. And another thing we've found out is that the modern mom, they are saying, I'm delivering the baby, and I'm hiring my consultant, my obstetrician, or my midwife to help me increase my chances of having a healthy baby and a healthy pregnancy. But I'm the star here. You are the supporting cast. We're a team. Once upon a time, mothers just kind of did whatever they were told to do, and the babies were taken and somebody else delivered the baby. Now, the mother delivers a baby. And you mentioned the magic words, educate and empower. That's exactly what we want the Healthy Pregnancy book to do.
Now, Doctor, you just mentioned the importance of nutrition, and the American diet has changed dramatically in recent years. Obesity is on the rise. We're raising children today to be sicker and die younger than ever before. So what impact has our diet, the increased sugar and fat, what has that done to pregnancy and birth weight? I mean, I remember when I was younger, the average babies were 6-7 pounds, and I think now, correct me if I'm wrong, but isn't an average baby about 8 pounds?
Yes, and I'll give you an alarming statistic. The Center for Disease Control, which is a government think tank, and every so often they make predictions. They have all the experts from around the world come in and make predictions of our health trend. And in the year 2000, they predicted that unless Americans change the way we eat and live, 1 in 3, that's 1/3 of children will become diabetic. Unfortunately, this is becoming true. But the good news is the new science called nutrigenetics, and that simply means how food affects the gene. And all those genes that are inside and growing in that baby, the millions of them, you can affect how well those genes behave by what you eat and how you eat.
So, Martha, what should a pregnant mother's diet look like?
First of all, she should not be eating any packaged food. Anything that's packaged is very far removed from what nature provides. It will, the ingredient list will read like a chemistry kit. That's what not to eat. What we encourage moms to eat, top one on the list, is wild salmon. For 2 reasons. It's excellent source of protein and the high level of healthy essential fatty acids, omega-3. And then from there, the list goes on to include some important fruits and vegetables and other sources of protein. And Bill likes to keep it simple. He has a list of 4 ways to build a healthy baby. That is to go fish, meaning eating healthy seafood. Go blue, meaning eating the dark blue fruits like blueberries, brain food. Go green, meaning the dark leafy greens. And go nuts. So we have go fish, go blue, go green, and go nuts. And when we say nuts, the important thing is that they need to be raw nuts, unprocessed. Walnuts and almonds are the top pick for the nuts. So those and of course we could go on into the eggs and the tofu and good healthy lean meat, but the emphasis needs to be on fruits and vegetables and on omega-3 fatty acids.
And the reason for Martha mentioned the fatty acids, Joan, is we get mothers to remember it. We say, you are growing a little fathead. Now, the growing brain of a baby is 60% fat, and that's why a healthy diet during pregnancy is right fats, not low fats. And mothers remember that when we tell them, you are growing a little fathead.
Now, Doctor, you just mentioned the developing brain. How much of what goes on in the external world is interpreted in the baby's brain while it's developing? Is the subconscious programming beginning at that point?
Yes, there's a study that just came out several weeks ago. In fact, I wish it had come out in time for us to include in our manuscript, that babies learn in utero, and the learning is of a level that we didn't really think possible. The babies learn the voice prints of the family, especially the mother, so that they pay attention to those same voices after they're born and also other sounds in the environment. So the baby is learning to recognize those distinct sounds.
Well, and I remember, as I said, years ago when I was pregnant, people played music and they always talked to the belly because we believed that the baby could hear all of these things and be influenced by it. But what you're saying is that it really is so much more than we ever imagined.
Yes, it is.
Doctor, in the beginning, you mentioned about how women now are educating themselves and becoming more empowered. And what are some of the different birthing methods that are available? I remember I have 2 boys. They were 3 years apart, and my eldest is now 21. When he was born, it was a very clinical setting. 3 years later, it was a little bit more like a hotel, and everyone was so proud of the birthing room, and it went from this hotel-looking room almost automatically, it was like knock the table away, put up the base, and the baby was delivered. But I know now there are so many different options. What are some of these things that women can choose?
Well, our best option now is a water labor. And many birthing rooms now will have a water tub, a big tub we call labor tub, where a mother can labor in water. And what a labor-saving device water is.
Well,
what does that do? How does that make a difference?
Well, with my 7th birth, I have relatively easy births, and so when during this birth, the pains in my lower area, the pelvis, got really intense, more than I'd ever experienced. And I thought, well, that's a signal to tell me that something needs to change in the way I'm moving around. And I had already planned ahead of time that I would have the access to water to use in the labor, and that was my body's signal to me was this is the time to make use of that water. I got into the water up to my, as high up as you can get it into your upper body. And after a few contractions, it felt like someone had given me an injection of Demerol. The change was that remarkable. It was a way for my body to relax and get a little free floaty in the water. The pressure, the counter pressure that the water's providing for my pelvic muscles and lower abdominal muscles, it just was a beautiful experience of how easy it is to have a natural intervention with no side effects.
Are there benefits for the baby to be born in water as well?
Well, we didn't have our baby actually get birthed in water. We just had the laboring at that later part in labor where I needed the pain relief. And then, when I knew I was ready to begin the pushing, I was happy enough to get out of the water. But yes, many midwives now, especially in a hospital setting or a birthing center setting, are allowing their mothers to give birth in the water. And there definitely is a smoother transition for the baby to just slip out of the birth canal into the warm water and then quickly be brought up right onto mother's abdomen, so that there's just an easier, more familiar environment that lets the baby sort of gradually come up to, here's the world you're coming into. It's not a harsh place. I like to keep the lights lower, and the baby is just naturally transitions onto mommy's tummy, looking right up at mom with, the familiar place that a baby needs to be right after birth, whether the mom's in water or not. This is where baby needs to go right after birth, is right onto mommy's tummy. It's that place where the baby will feel safe and not get stressed.
And the one of the main questions we were asked, and mothers would say, what can I do to decrease my chances of a surgical birth? 1/3 of today's babies in many hospitals are delivered surgically.
I mean, many hospitals, it's more than 1/3.
Yeah,
I think
you
so.
think, no, there isn't an organ in the body that so-called fails 33% of the time. And the whole term failure to progress is the number one reason for a surgical birth. Now, mind you, surgical births are safer than they have ever been, and they are life-saving in many circumstances. I was at one time, I did a lot of delivery room work, so I attended a lot of surgical births, and they were life-saving. So they're with modern surgical techniques and modern anesthesia, they're safer than they've ever been.
But the bottom line is the surgical births really only need to happen in 10% or fewer.
Right.
Absolutely.
And so the fact that we have 30, 40, even 50% of surgical births is ridiculous.
We've been talking about the pregnancy, but what about now? You get home with your newborn. What can parents expect the first few weeks?
A major change in life as they've known it. They have this brand new little person who has very high needs, constant need for obviously feeding and holding and warmth and security, and yet the mother's need for rest and sleep and good nutrition is equally as important. So for parents to understand that this major change is coming, you really can't tell them until it happens that this is really what life is going to be like now. The first-time expectant couples need to know that it's not just all fun and excitement, and they will quickly find that out with the nights that get interrupted. Night's sleep gets interrupted. Babies can develop some painful crying episodes that needs to be dealt with. The mothers need to be mothered themselves, so that dad will be on call to really help them. In the first 6 weeks is really the main transition time into establishing a healthy breast milk supply, getting the mother's body healed and returned to normal, so that she can then enjoy her baby's infancy, to get herself off to a good healing start, especially after a surgical birth, of course. And so just to giving that baby the best start in life, to have a good attachment with his mom, makes a world of difference then as the rest of the babyhood and toddlerhood comes along. We cannot say enough about the importance of getting the right start in that first month.
The book is The Healthy Pregnancy Book by Dr. William and Martha Sears. If our listeners would like to get more information, where can they go?
Our website is AskDrSears.com, and that's Dr. Dr. Ask Dr. Sears. And we have a wonderful website with lots of good information and interactive elements.
We have about 30 seconds. In 30 seconds or less, what is one thing that you'd like to leave our listeners with, Dr. Sears?
Do your homework. Read our book, get educated and empowered, and realize that the most miraculous hormonal symphony is being played inside your body, and we just want to help you play beautiful music for you and your baby.
And you know, one thing I want to leave the listeners with, a lot of the information that we've talked about that's in your book is general health information that really anyone can benefit by, nutrition and sleep. So really, if you buy it for someone else, take a few minutes and look through it yourself. There's wonderful information in there. Again, thank you for being here with us, and I hope to have the opportunity to talk to you again.
I hope so too, Joan. Thank you.
Thank you, Joan.
We'll be right back. It's time for this week's Medical Minutes. Joining me today is Dr. Michael Gross, the Medical Director of the Active Center for Health and Wellness and the founder of Active Orthopedics and Sports Medicine in Hackensack, New Jersey. Dr. Gross is the author of the new book, Get Well Soon. Welcome, Dr. Gross. Thanks for joining us today.
Thank you for inviting me.
Dr. Gross, so often we hear the terms integrative, complementary, and alternative medicine. What are these medical modalities, and what are the differences between each?
Joan, that's a great question. A lot of people use those terms interchangeably, and they're really not the same. Alternative medicine is, even before I talk about alternative medicine, I want to talk about, first, to understand there's what we consider to be traditional Western medicine, where patients get sick, they go to the doctor, they're given medication, and they get better. Or they have surgery and they get better. And that's the Western medical model. We're starting now to use preventative medicine, but still on a very scientific, very proven, very traditional basis. When we talk about alternative medicine, we're talking about using less traditional modalities, things like acupuncture, massage, but even things like diet and vitamin supplements are considered one of the number one alternative medical modalities in the United States. But the word alternative is important because it suggests that it's used instead of traditional medicine. Complementary medicine suggests that you have traditional medicine and less traditional, more alternative type things, but working in parallel, working together. Two trains traveling in the same direction but on different tracks. So you may go to your doctor, your family doctor, who's going to prescribe medication for blood pressure, but then you might also go to an acupuncturist who would help you to also reduce your blood pressure and reduce stress, but the two of them don't communicate. Integrative medicine takes the best of proven alternative modalities and integrates them into a Western traditional model so that your doctor would send you to an acupuncturist as well as use medical treatment. And he would communicate with the acupuncturist so those two treatments could work together and optimize each other's effect rather than work independently or instead of each other.
Do you think that integrative medicine is the future of our medicine?
I think it's the present. I think the future, things are going to become more integrative, but as we move towards a more preventative model and more about preventing disease or preventing recurrence, the only way we're going to do that is by adopting an integrative model.
So it basically treats the whole person.
Exactly.
Now, within integrative medicine, we hear the term anti-aging medicine. What exactly is that? I mean, I think people think that that's Botox injections, and it's not anything like that. So what is anti-aging medicine?
Anti-aging medicine is not some science fiction way of stopping the clock, and it's not about just making you look good. Anti-aging medicine understands that we all age, that the calendar moves forward. But what anti-aging medicine tries to do is to keep you functioning at your best as the clock moves forward. So in a male who may have declining testosterone levels, his muscle mass begins to decrease, he starts to put on flab in the middle, his sex life may start, or his sex desire may start to decline, his energy level may decline, his concentration may decline. What anti-aging medicine does is by restoring testosterone levels to a youthful level, we try to delay or reverse some of those changes.
I would imagine finding a practitioner for some of these areas may be challenging. So what is something that someone needs to pay close attention to when they're finding a doctor or someone who's offering these complementary modalities?
Well, I think you have to speak to the doctor. You have to know what their credentials are. They should be board certified. And in an integrative model, they should probably be board certified in family medicine or internal medicine, as well as in a complementary modality such as anti-aging medicine, or if they do something such as acupuncture, they probably also should hold advanced training. That one of the problems with acupuncturists is that there are licensed, well-trained, master's level acupuncturists, and there are doctors who may have taken a course over a weekend and feel like they should be doing the same sort of thing that a lifelong acupuncturist, someone who studied their whole life, is doing. So you have to check into their background a little bit and the level of commitment they have to the modality they're using. You also want to talk to them and make sure they're not making outlandish promises. A doctor who says all you have to do is come to me once and I'll give you one treatment and we're going to cure everything, probably that's something that you should be suspicious of. But somebody who says, this is what we do, this is the things we can improve, and these are the things we can't help you with. Remember the old saying, if somebody promises you something that's too good to be true, it's probably not true.
Dr. Gross, thanks for joining us today and talking about the new direction, or as you said, the present direction of where our medicine's heading, treating the whole person. If you'd like more information about Dr. Gross, you can visit the website, theactivecenter.com, and be sure to get a copy of his new book, Get Well Soon, which is available at Amazon.com. We'll be right back.
November, it's turkey time. If you have the honor of hosting Thanksgiving dinner this year and you have worries about making the perfect turkey, don't fret. Anyone can cook the perfect turkey if you know what to do. The first thing you want to consider when purchasing a turkey is the size you'll need. Choose a turkey depending on the number of people you're serving. You'll want to allow for 1 pound to 1.5 pounds of turkey per person. If you have other meats, stay around 1 pound per person. Make sure you allow plenty of time to defrost the bird. It can take up to 4 days for a 20-pound turkey to defrost. Allow 24 hours for each 5 pounds of turkey. While defrosting the turkey, defrost slow in the refrigerator. Never leave your turkey out on the counter at room temperature. That's a no-no. A turkey should always be defrosted before cooking. Stuffing cooked inside the turkey is extremely moist. You can try something different by adding fresh sage, thyme, rosemary, and sausage, apples, or chopped chestnuts. You may want to bake your stuffing separate in a baking dish. It retains the flavor and texture of the ingredients. Before roasting your turkey, make a fresh chopped thyme and sage herb butter spread with granulated garlic. Let soften. Gently rub the butter mixture between the turkey skin and meat so the turkey self-bastes while it cooks. Always use a meat thermometer to test for doneness. When the turkey is done, remove it from the oven. Tent it with aluminum foil and let it rest 20 to 30 minutes before carving. For recipes and cooking tips, visit cookingwithcheftodd.com.
We all want to live a happy, productive life, but sometimes we just need a little help. Our Coach on Call segment provides strategies to help you live your best life now. Joining me today is Marcia Wieder, author and personal transformation expert. Marcia's appeared several times on Oprah and The Today Show, and her work has been a catalyst for thousands to help them make their dreams become a reality. Her PBS special, Making Your Dreams Come True, is the title of her book. Hi, Marcia. Thanks for joining us today.
Thanks, Joan. It's great to be here.
Marcia, we're talking about following our dreams, and for someone who is paralyzed with fear, what is something that person can do to take action?
Well, a lot of people will say to me that the biggest obstacles that are stopping them from going for their dreams are, time and money. I don't have enough time. I don't have enough money. But when we drill down just a little bit deeper, what's right there is the biggest obstacles. You just touched upon it. Fear. Our fear and doubt. Our fear keeps us from ever opening up our mind to possibilities, to exploring other ways. Like, instead of going, well, I don't have enough money, or but what if I go for it and I fail? Dreamers have learned wherever there's an obstacle, even an obstacle called fear, design a strategy to manage it.
Marcia, what is your 3-step process that someone can follow to make his or her dream come true?
The 3 steps, I have a very simple way of talking about that. When you go to school, you learn the ABCs. Mm-hmm. Well, at Dream University, we teach the CBAs. C, get clear about what it is that you do and don't want. And for many people, that's the hardest step. B, believe in yourself, which is a choice. We know that we're aware that our attitudes and beliefs are never neutral and that they either move us forward or hold us back. But I think we often forget that we can choose what we believe. That's a choice. And then A, prove that you really do believe in your dreams by taking action. And by the way, to all the women who are listening who think, well, isn't it selfish to focus on my dreams? Shouldn't I be putting everybody else's needs before mine? Well, not only is it not selfish, but it's an act of generosity to do more of what you love and to live a passionate life. Everybody's lifted up by who you are when you're doing that.
If you'd like more information about Marcia, you can visit her website, marciaweeder.com. That's WIEDER, marciaweeder.com, and her book is Making Your Dreams Come True. Thank you for joining us today. We hope you found the show informative. At Change Your Attitude, Change Your Life, we believe that knowledge is power. Take what you've learned, apply it, and live your best life now. Remember that this information is for educational purposes only and should never replace the advice of a professional who knows your personal situation. If you'd like more information, you can visit our website, cyacyl.com. That stands for Change Your Attitude, Change Your Life. While on the site, listen to past shows on demand, read the digital magazine, take part in the book club, sign up for the mailing list, and be sure to follow the show on Facebook and Twitter. Until next time, this is Joan Herman. Thanks for tuning in.